Brain injury is a silent epidemic. In 2014, there were over 300,000 cases of traumatic brain injuries caused by car accidents. I'm Dr. James Zender, a clinical psychologist. For the last 30 years, I've specialized in the field of psychological trauma, beginning with work in a level 1 trauma hospital in a major urban area. Since then, for the last 15 years, I've specialized in treating auto accident survivors in my private practice. The information I'm going to provide will be useful to legislators who are interested in making the road safer and car manufacturers who are focused on making safer cars, to human resource professionals who are dealing with employees who have sustained injuries from car accidents, from attorneys who are involved in taking depositions and interacting with clients or defendants who have brain injuries from car accidents. So brain injuries certainly happen along a continuum. There are very minor concussions and the effects only linger for days or weeks. But in severe cases of brain injury, the effects can be years or permanent. Often these injuries are not recognized. Yet the patients feel they are not themselves. They have problems with memory, concentration. They have chronic headaches, sleep disturbance, and depression. Many times the brain injury is not recognized or detected due to the medical attention on other areas of the body that are obviously injured. Many brain injuries do not show up on imaging studies such as MRIs, CT scans, or X-rays. If a brain injured patient is involved in litigation and a defense attorney is questioning them, it's not uncommon under increased stress for the person's behavior, their ability to function cognitively with memory and thinking to deteriorate. It doesn't necessarily mean that they're intentionally trying to conceal information or they're being fraudulent. It well could be that due to their brain injury, they simply can't recall. Often the person themselves will not realize that they've changed. Sometimes behavior can become erratic. They can engage in impulsive actions that normally they wouldn't. The brain injuries are so complicated that we can't just take a little slice of behavior and think that this is the result. The person has to be observed over time, and only then can the effects truly be determined. In the blink of an eye, the person's identity of who they are can change. A few seconds prior to the accident, they can be one person, and after the accident, they can feel like somebody totally different, particularly if the frontal lobe is affected, which has to do with recognition of self or sense of self. And this is one of the most distressing kinds of symptoms to see. So our understanding of neuroscience has advanced tremendously in the last decade, 20, 30 years. So we now know that the brain can change itself. It can rewire itself when injured, and that brains can produce new brain cells, and that the brain can compensate for damaged areas by transferring functions to other parts of the brain in an area that's now called neuroplasticity. Brain injury awareness is something that we all need to be concerned about. And the cost to society is great, and we need to find ways of preventing brain injuries. It's much easier to prevent a brain injury than it is to treat it and try to help the person heal from it. So how might we do that? Well, there's very promising developments with autonomous vehicles. Ultimately, if we can remove the factor of human error, which is known to be responsible for at least 90% of auto accidents. It will help to greatly reduce the number of accidents and head injuries. So what do we do in the meantime to reduce the number of head injuries, the 300,000 that are being caused currently from auto accidents? Well, again, we go back to 90% are due to human error. So this requires a multi-pronged approach, which will have to involve the insurers, law enforcement, legislatures. How do we deal with people who drive recklessly, who are involved in road rage, who repeatedly engage in driving while under the influence of alcohol or drugs? These are questions that society has to more actively address